Hello, back to my channel. So this is an educational video. Before I begin this video, let me remind you all, please subscribe my channel and press the notification bell. If you are not click on the notification bell, you are not getting updates of my new videos are posting in my channel. Okay, please subscribe and press the notification bell. And you think this video will be beneficial for your friends or any of your family members, please share this video. I have seen lots of people are watching my videos, but they are not subscribing my channel. So I have seen in the data that only 2.8% of people subscribed my channel, and 98.2% are not subscribed. So I'm kindly requesting you to all subscribe my channel, because we have only 174 subscribers in my channel. That's the reason I thought maybe you are not that much interested in my channel. That's why I wasn't posting enough videos. But I have received lots of email that you are very interested and you are very keen to watch my videos, and you felt that I'm really giving a good motivational really giving you a good motivation to write your exams again, even though you felt like you are depressed, you failed in your exam and you don't want to continue writing your exam. So my videos helped you to rethink about to attend the exam again. So I'm very happy to hear all these good comments. So please subscribe my channel. Okay, so let me tell about today's videos content. Like, I'm going to discuss about some topics that can come into CBT exam or the OET exam, or you can use it will be useful for your OSCE exam, or it will be helpful if you are going to work here in the UK as a nurse. I don't know about other country. I haven't worked there and I haven't speak with any of people who worked there. Okay, let's begin the video. I'm talking about vomiting. You all know what medication we need to give for vomiting, isn't it? So when if a patient will start vomiting, what will happen? Like a chemoreceptor trigger zone to that, and a vomiting center will be triggered. So there are what we give for the patient if they are vomiting, like the doctor will prescribe some anti-emetics medication. Yeah, so what I want to say, if a patient is vomiting, which position you give to that patient, you won't allow the patient to be lie down in their back, because there may be a tendency for them to be for them to choke and aspirate that vomiting. Then there is a chance of them to die. So we don't want that to be happen. So best position for them to be side lying position. Okay, that will help. Or even though some patients choke with their own saliva, so side lying position is the better position. And another things I had to about the medication. What I want to say, there are the first medication the doctors prescribe usually is cyclizine. Like that means the cyclizine is the less sedative medication, so that's why doctors used to prescribe that medication first, cyclizine. Okay, especially for post-operative patients. Then dopamine antagonist. In dopamine antagonist, there is a metoclopramide, and domperidone also act on receptors in GIT, can reduce abdominal bloating. So it will reduce the abdominal bloating. You know what is abdominal bloating? Yeah, that will prevent if if you give the metoclopramide or domperidone. Okay, I have seen metoclopramide in using in the NHS hospital. I haven't seen domperidone much. Okay, maybe I didn't come to contact with that. That's why I don't know. So neurological side effects with the long-term use and higher doses, or levomeprazole, broad spectrum sedating and analgesic effect often for palliative care setting. The patient who is on palliative care setting, like if they have an end of life care, if they are nearly dying, that type of patient, this medication usually prescribing by the doctors. Okay, other antiemetics like benzodiazepine, I have seen doctors prescribing this type of medication. That's work in CNS to inhibit GABA neurotransmitter. Okay, hyoscine hydrobromide. In hyoscine, there are some patches like hyoscine patches. Some of the patient has using that hyoscine patches over here, near to the ear. They can change. I think the patches usually using once in a day. That is acts directly on the vomiting center. Cannabinoids, binoids, so inhibit nausea and vomiting caused by substances that irritate the chemoreceptor triggers on. Okay, neurokinin and first antagonist act as NK1 receptors in chemoreceptor trigger zone, most effectively treatment of chemotherapy. Induced nausea and vomiting when used in conjunction with H3 antagonist or dexamethasone. The patient who is undergoing for the chemotherapy, that type of patients, neurokinin medications is prescribed by the doctors. Okay, so what else I need to say? I have discussed how the procedure of how to insert the NG tube or urinary catheterization. So I'm not going to describe all those things, but there are some key points you have to remember during the catheterization. Like always use the aseptic technique because there is a chance of contaminations. So you may transfer the infection to the patient. So always make sure you are wearing the proper gloves, and if you are cleaning the meatus, you are on one hand you always use a sterile hand and one is unsterile hand. Okay. And always use sterile water to fill the catheter balloons, and choose the smallest size of the catheter necessary for adequate drainage. 12, 14 and 16 gauge sizes are available. Okay. There are three type of catheter, like a two-way Foley catheter. That's a short for medium or long-term bladder drainage, or three-way Foley catheter, that's balloon catheter, that's for continuous irrigation, like post prostatectomy. Okay, so the catheter who has not, it hasn't got a balloon, that means the intermittent catheter, or that's only one channel. That catheter we usually use for the patient who there's another name, in and out catheter. The patient doesn't want to have the insert the catheter, so they can. Some patient is able to manage themselves. They can insert the catheter and pass the urine. Then they will remove. And I mean, it's a single-use catheter. Yeah. So they can empty their bladder. That patient is not unable to pass urine naturally, that's why. And I forgot to mention something like a three-way Foley catheter. That means the patient who need irrigation, or sometime we use that three-fold catheter like patient's urine is so cloudy, or too much there is so many contents in the tube, so, or a blockage, so it clear the bladder, or that's why sometimes we use that three-way Foley catheters. Okay. Then another thing I wanted to mention that I have already mentioned that you have to make sure you will follow the sterile technique. Okay. Then another thing I wanted to say, like when you place the catheter drainage bag, make sure you place that below the bladder. If you keep that, if you just imagine if the patient is, sorry, it's so cold, I'm wearing my gloves, sorry, okay. So if the patient is lying down like this and you lying on the bed, so you hook that catheter drainage by here itself, then there is a chance of backflow. So urine may flow back to the bladder and it may cause the infection. So always make sure the catheter bag hang lower of the patient's bladder. Okay. One more thing I want to say, like if you need to hourly monitor patients' urine, then you have to use the urometer, not the normal catheter bag. Urometer costs around 60 pounds, so make sure you use wisely. Only the patient who required the urometer, please use it. Okay, otherwise please don't use it. It's very expensive. Another thing I want to say, there is another method of catheterization, like suprapubic catheterization. Some patient who may have the prostate, that type of patient is really difficult to insert Foley's catheter. The urology doctor, usually we refer that patient to the urology, then the urology doctor will come and do the catheterization. So in that time, most patient, they try to insert the suprapubic catheter. That means insertion of the catheter through the anterior abdominal wall into the dome of the bladder. And they use the ultrasound for doing this procedure. There is I have already mentioned about the prostate problem, or some patient who has problem with the nephropathic bladders, or long-term condition, or MS or spinal cord injury people, or people who has decreased the risk of urethral infection of drainage, or a patient who has a bowel surgery. Okay, there are lots of indication for this. Okay, then bladder irrigation. If you do the bladder irrigation, always use a normal saline. Okay, 0.9% of normal saline. Then usually when you insert the catheter in NHS hospital, you have to fill the catheter insertion form. You have to mention how did you follow all the hand hygiene technique, aseptic technique, there is a drainage come out, why you are using the catheter, did you gain the consent, all that question you have to answer, and you are just signing yourself like you have followed all these techniques. Okay, and the catheter bag usually usually need to be changed every 5 to 7 days. Usually there's a space in the catheter bag. You can write it when this bag or catheter. I'm talking about a catheter 5 to 7 days, or catheter bag, so not catheter. Okay, catheter, it says around, I think some catheters are long-term catheters, but catheter bag should be changed in 5 to 7 days, and you can write it in the catheter bag which date you have placed this bag. Okay. So that way other colleagues can understand when you insert the catheter and you need to change the bag. Okay. Then there are nephrostomy tubes that people who has a urinary obstruction or and I have to say like any urinary diversion, or assess for the therapeutic intervention or for diagnostic testing. Then nephrostomy bag you have to change when it is 4 by 3 full, mostly when it is not completely full, more than half. When it is more than half, you have to empty the nephrostomy bag. And same like the tubes must be changed every 3 months. Okay. So this is all the things I have wanted to say about the catheterization and catheters. I hope this video will be helpful for you. If you like this video, please don't forget to subscribe, share, like, and press the notification bell. I will come with other topics. So if any mistake I have said, please correct it. So thank you very much for watching my videos, and bye bye and take care.